So yesterday we talked about different parts of brain, spinal cord, everything. Okay. So next is cerebellum. Okay. From here we have to discuss. So basically cerebellum already I told you that it is a back. It is situated backside of the head. Okay. Where mostly females get to tie their uh, hair. Okay. So this is very important. Cerebellum. You can see that it is. Like structure of mostly the acroot. Okay, acroot type structure. Okay, you can see here also the cerebellum. What is the main function of cerebellum? So it is basically a coordinator. What is its function? Coordinator. Okay, and second is it is very important for balancing. Okay, balancing muscle tone. Okay, position or posture. Okay, because without uh, balancing, without your proper posture, you are unable to do anything. Okay, so here it will help a lot to give you a proper position. Okay, and whenever you move your head, neck, or hand, okay, whenever you walk, so everything need proper balance. Okay, so if you want to raise your hand, so sometimes you need power, sometimes you doesn't need any power. Okay, just you want to raise your hand for explanation. But when you are lifting a pen, you need little more effort. Okay, you need whenever you want to lift a bottle. This is 1 liter bottle. You need much more effect and more power than lifting a pen. Okay, so how this is calculated? Because of cerebellum. Okay, because of cerebellum, the calculated power is generated by cerebellum and it is supplying to your muscle. So this is much more weight than pen. You need to balance it. Okay. So suddenly I am lifting pen. Within 1 second I am lifting bottle. But everything is in balancing. Sometimes I will lift 5 liter bottle, 5 kgs bottle. Sometimes even then much more than 5 kgs. So how this is balancing? Your muscles doesn't take time to lift that weight. But if you are lifting much more than normal weight, it will take time. Like suddenly, if you want to lift 50 kgs, you are unable to lift. First, what you have to give? You have to give muscle power. First, gradually, you have to take 10 kgs regularly. Then after 15 kgs regularly. Then after 20 kgs. Some days will continue. If you continue this, then one day you will pick up 25, 50 kgs also. Okay, but how this happen? By increasing muscle power. So all this because of cerebellum. Okay, so this is very very important, and along with other things also there. You if you are want to lift a coffee. Okay, so how you do lift? With gradual intention, will pick up the coffee with very care, because if this the hot coffee will fell, what will happen? Will It will burn us. So it will calculated everything by the cerebellum. Okay, so if the cerebellum is not working properly, patient unable to lift, he doesn't have coordination. Okay, unable to lift his hand, leg. Okay, the muscle power is good, but that much power needed, whatever needed power is not there because of cerebellum. So it is very, very important to us. Okay, so whenever a neuro patient come to your clinic, so you have to examine all this. Okay. The next is hypothalamus. Hypothalamus, it is a very important. and much more important gland, and it is called master gland. Okay, after that hypothalamus we have thalamus and pituitary gland. So what it will secretes here, I have to mention this because it is very important. Okay, you have ADH, releasing hormone. Okay, and regulation of temperature, regulation of food intake, and autonomic nervous system functions. Okay, and and emotional. Okay, emotions and body rhythm. All these are the functions of hypothalamus. First is hormones. So we know that ADH and oxytocins are released by pituitary gland. So, but basically these are production of hypothalamus. Okay, ADH and oxytocin. ADH is the hormone, antidiuretic hormone. Okay, so however water you are drinking, okay, whatever fluid is there, what will happen? Get it will purify in kidney. Kidney, what will we do? It will throw all this liquid into the urinary bladder. From the urinary bladder, it will get rid of from the body. Basically, what will happen? Whatever amount is rectifying or purifying, all the amount of fluid is not excreted because of ADH. So all the amount of uh, fluid is excreted. So what will happen? We need lot of, we will get a dehydration. We will have sweating. We'll have thirst. Always be thirsty. What will happen? We have ADH harm. It will stop. It will not get the much more amount of fluid from the body. So whatever required amount, it will reabsorb by the kidney itself by tubules. So we have ADH hormone. Okay, if the amount of water is balanced in the body, so extra amount is thrown out. Okay, then the ADH hormone is decreased. So then what will happen? You will have urination. So then the again you have decreased amount of water in the body. What will happen? So again ADH is released. So the receptors will absorb the water level in the body. Okay, if you doesn't drink a little water from morning to evening, what will happen? You will not get a single one time urination because you are not drinking water. So what will happen? ADH hormone is continuously releasing by the pituitary gland with the help of hypothalamus. So it will not able to excrete the amount of urination. What will happen then? You will have burning micturition. You will your because of the stored amount of urination, it will the color of the urination is changed. Okay, it will become yellow. So what will happen? These things are happen. So this is I'm not explaining detail, but already explained. So here we have to know the importance of ADH. Same amount of oxytocin. Oxytocin also very important during labor. It will give the contraction to the uterus. Okay, and the other hormones also released by the hypothalamus. What are growth hormone releasing hormone? Actually, growth hormone is produced by anterior pituitary gland. But when you have to improve, when you have to release, these orders are given by hypothalamus. Hypothalamus give order to pituitary gland to release growth hormone. So the order name is growth hormone releasing hormone. Okay, growth hormone releasing hormone. Other than that, it will see the temperature in the body. Okay, whenever extra amount of temperature arises, what will happen? Sweating will come. If the temperature decreases, what will happen? We will have shivering. Okay, so the temperature is regulated by, so in the cold, in the winter, the temperature arises in the body minimum 0.5 degrees or 1 degree. In the hot or summer, what will happen? The temperature of the body slightly decreased zero point 0.5 temperature, degree Celsius or Fahrenheit, 1 degrees Fahrenheit. Okay, it is because of hypothalamus and the regulation of food intake. So how you are understanding that you are getting the, you want to eat the food with the help of hypothalamus itself. So because of hypothalamus, what will happen? You're able to eat the food. So they are the regulation of secretion of chemicals, okay, that will absorb the amount of fat, the amount of glucose, all those things, okay. So we will get the sensation in the hypothalamus. Next, the most important thing is that the autonomic nervous system. What will it will activate the regulatory activities to the heart, blood vessel, intestine. Okay, all these things. Next, other than this, very important is emotional situations. Okay, emotional situation like anger, happiness, joyness, sorrow, okay, ugliness, everything, whatever the five types of emotions we have, okay, all those emotions are coming from the hypothalamus. So what will happen whenever emotions are highly more than high, fear also. If the anger is more, what will happen? Hypothalamus is affected. So if hypothalamus is affected, unconditionally pituitary is also affected. Okay. And if pituitary is affected, all the hormonal glands are affected, like thyroid, ovaries, everything, testes, everything. Okay. If the hypothalamus is affected, what will happen? If you are more anger, the production of metabolism is happening more, and you will get the rise of temperature in the body. And again, sometimes you will get more want to eat the food, because what will happen, the more metabolism occurs, the more you want to eat the food. Okay, because of food intake. Okay, because hypothalamus is related to the food intake also. So we have to control our emotions, because if one thing is uh, one thing, the hypothalamus, the function is disturbed, every organ function is disturbed. Okay, and all things are rhythm. Okay, we have to maintain everything is in balance, rhythm, not in the higher position, not in the lower position, like our mood, sleep cycles, and in the female, everything like in female menstrual cycle. Okay, all this we have to do in the very little fluctuation. Okay, little fluctuation, sometime up, sometime down. This rhythm is very important. But if this ups, suddenly it will down, sometimes it will up and it will down, what will happen? It will give very bad effect to the body. Okay, what will happen? 24-hour rhythm is maintained by hypothalamus. So hypothalamus is very, very important in our body. Don't underestimate the power of hypothalamus, because hypothalamus is the master gland. Okay, next is thalamus. Thalamus also is very important. It is supportive to the hypothalamus. Okay, and the thing is we have to understood about hypothalamus is sometimes what will happen, sometimes we need intentions. Okay, we have to need to intention to do a work intentionally. Sometimes we will do uh, non-intentionally works, like you are reading a book. What will happen? You are reading a book. What will happen? You are very interestingly reading a book. What will happen? You are intentionally reading a book. Okay, suddenly someone calls you some, likewise in today most of the people are busy in phone, in the messages and the reels, etc., etc. What will happen? Suddenly you are reading the book, some message came. Okay, suddenly your intention towards reading is reflected to other things. Okay, how this is happening? Because of the thalamus. Now what will happen? Thalamus is uh, suddenly your intention towards the book is changed to unintentional thing. Okay, unintentional thing. Okay, so because of this, thalamus likewise most of the functions are there, but here we are not going deep. So this is intentional and unintentionally whatever you are doing due to the thalamus. Next was cerebrum. Cerebrum, we know that this is the cerebrum. All this is known as cerebrum. This is a uh, big area. Okay, in that we have frontal lobe, parietal lobe. Okay, here we have the parietal lobe, occipital lobe, and temporal lobe. Every lobe has its function. Okay, and we have 200 million neurons. Okay, these are the number of millions, but it is not only this much, much or less than nearby 200 millions neurons. Okay, and we have this area, we have deep grooves. Okay, what we will call Silas or Gyri, Fisher. Other all these are name of the area of the brain. So you have different lobes. In the frontal lobe, you are able to see all these things. I will show you the this diagram only itself have. So will not go in detail. I will summarize here only. So we have frontal lobe. The frontal lobe we have the premotor area, motor area. Very important. Motor, whatever speed, whatever I am walking using the writing the from the pen, or whatever functions I am doing with my limbs, all are known as motor. Okay, and in the main function of the occipital lobe is here we have the visual area. Okay, and visual association area. Visual means normally you are seeing. Visual association area is with the help of visuals what you want to do. Like I am saying the board, now I am understanding it and converting this everything into my speech. It is due to the help of visual association area. Okay. Next, we have parietal lobe. In the parietal lobe, we have two things: sensory association area, general sensory area. Sensation, it is a here you have the phone. Just I have the touch sensation. But when I have once a call is coming to me, what will happen with the help of visual association area? The waves are converted to the general sensation association area. With the help of that, images are transfer to the motor area. With the help of that motor area, I am picking my phone and lifting the call, and I am if it is important call, what I will stop my work for some time and I will talk to them. So within this, all this happening in our brain. So very uh, more than a software, more than a anything, we have a supercomputer that is brain. Next is we have parietal temporal area. Temporal area very important for speech. Whatever speech you are giving, that is very important. But here we have speech associated area. So you're not talking whatever you want to talk. You are understanding the scenario, understanding the condition, and according to the condition, you are giving the speech or you are talking. It means due to the association area. So whatever necessary things you will talk. So whatever or whoever a person have auditory association area is very damaged. What will happen? They will talk anything. They will give they are because they are not understanding that what they are trying to say. Okay, so these are the things we have to understood. And if you want to go deep, please revise all those things. All our things are mentioned here. Okay, and we have basal ganglia and corpus callosum. Everything is there. And the third important thing is that the brain has three coverings. Okay, we will call as meninges. In that we have fluids. You can see that this is the skull skin. Your skin. This is the skin, and we have the skull. After the skull, we have dura mater. Okay, dura mater, and here we have the pia mater and aragonite matter. Dura matter, aragonite matter, and pia matter. So in that we have here we have in that we have cerebrospinal fluid also, which protects the brain by entering and most of the uh, and it is a protector. And second thing is that it will reduce the weight of the brain. Okay, like the uh, ship is in the sea. Okay, after that we have cranial nerves, very very important. We have 12 cranial nerves. Every cranial nerve has its function. You can, with this diagram, you can able to understand very easily. We'll start with number one, olfactory nerve for smell, optic nerve for eyes, trigeminal nerves for face, okay, for taste, everything, and acoustic nerve for hearing, vagus nerve for all the uh, swallowing, taste, everything what happening in the digestion, all these things. Accessory nerve, which is very important, and hypoglossal nerve for muscles of the tongue, glossal pharyngeal nerve, which is also for facial, for face, and the taste, everything is welcome. And in the oculomotor, trochlear, abducens, all these three nerves for eye movement, eyeball movement. Okay, you have this box, you can go through that. So all these are very important. You can see this is the uh, spinal cord. From that, we have two types of nerves are going that from one is going with the process. One is they have direct connection with the organs. So we'll have sympathetic and parasympathetic. So sympathetic is now very conditional, very regular basis work. So normal function is done by sympathetic. But parasympathetic is a it is a process of nerves which connected to the parts of the body, important organs like we have eyes, we have the salivary glands, we have foot, we have heart. All these are connected. Okay, why? And we have bladder, small intestine, large intestine. Because whenever emergency condition occurs, what will happen? It will give information. It will do something which is important. Not what are those things are not important. Okay, so this is we have understood. Like whenever needed, any like in front of us, some harmful thing is there. Like we have dog, we have snake, anything, any animal. What will happen? The we want to we want to we have two options. We have to fight with them. We have to run away from that. So if we want to fight with them or we want to go away from that, we need excitement. We need energy. Okay, we need uh, much more power than that. Okay, so at that time, parasympathetic is very important. Sorry, here some confusion. Okay, sympathetic is very important. Parasympathetic is normal flow. Sympathetic is very important. At that time, heart rate increases. Okay, at that time, respiration rate increases. Okay, at that time, what will happen? We want to do our BP also raised, pulse rate raised, and respiratory rate is also increased. What will happen? Because we have to protect ourselves from that harmful thing. So whenever a condition comes into our life, so sympathetic nervous system will activate. Okay, whatever important things will increase at the level of normal. Okay, so these are the important things, very important things. Okay, which I want to explain. So this is all about the summary of nervous system. So if you want to go on deep, you have to watch our regular class videos, anatomy, physiology, and you have to revise all those things you can understood easily. So anyone have any question? We'll go through that. From tomorrow, we will discuss the diseases of nervous system.